yeah, I was speaking to a midwife actually about this yesterday, and it does come down to power. Like when you think about it, you're in the pool, they don't have as much access to you. Like they can't control your positions. You're not going to have continuous fetal monitoring attached to you. All they're left with is intermittent auscultation. And, you know, it's this whole thing like that there's more work involved as well, because you need to be in the room more if you're going to be doing CTG. You're not going to have as much time for your charting or for other things. And, you know, at the end of the day, if you are a stretched maternity hospital, if you're an overworked midwife and you can't even guarantee you're going to get 5 minutes to go to the toilet during a 12-hour shift, it's much easier if you have your women with epidurals on the bed, ECG monitor, and that's tracking everything, and it's easier. You can get all your charting done, you can get it all done. And it's the system is so broken, it's forcing the women into a very unsafe scenario to help the system continue to function.
Welcome to the next episode of the Tracy Donegan Podcast. This is a big one. We're going to talk about documentation mistakes, non-consensual use of Syntocinon, punishment for asking for evidence-based care, birth debriefings that felt horrific, and an overall lack of accountability by the HSC. Claire Kerin shares her experiences of Irish maternity services and ultimately her decision to give birth at home without a midwife. If you're planning a VBAC in Ireland, you can now purchase my book on the Irish Amazon website. But let's jump right in. Everyone, you're very welcome to the Tracy Donegan Podcast, and today I'm delighted to welcome Claire Kerin, who's gonna share a really fascinating journey from being a first-time mom in Ireland and stepping into maternity services for the first time, and then following through her different birth experiences within Irish maternity services and outside of Irish maternity services. So welcome, Claire. I am really delighted to talk to you because I was looking through our messages this morning, and I'm like, we've been talking I think since 2022. So it's nice to put a face to the messages, and because I do know a little bit about your kind of backstory, but please let's just start at the beginning. And
yeah, so like there's a bit of a saga and a lot of twists and turns with me. So yeah, we messaged originally back in 2022 after the birth of my son, but really my story kind of starts in June 2019. So I was 20, how old was I then? I was 29, and I had suffered from a DVT, so deep vein thrombosis.
Wow.
And I had a very odd presentation. Like it took, I was back and forth over a few days before they actually realised, oh my God, you have a blood clot, because it all started with a backache. And it was a very unusual presentation. It actually started in my pelvis and actually travelled down. Clots don't do that, so that's very strange, and it ended up blocking my entire left femoral vein. Like my whole leg just lost blood supply, and that's when they realised, oh, this is a clot. And it turned out it was because I had been on the combined contraceptive pill. So that's kind of, my eyes kind of were opened, like, oh my God, like nobody ever, like, you know, it's kind of mentioned offhand to you, oh, there's an elevated clot risk and you watch out for X, Y, and Z. But like, here's me, a healthy 29-year-old. I run, I'm quite fit, you know, I love my swimming, you have quite a good diet. Like there was no other risk factors for a clot. And I had this extraordinary clot. Like it was quite a significant clotting event. I couldn't walk afterwards. I was on crutches for quite a while, had to attend physio to get, you know, mobility back and get back to my level of fitness. So I was told then, when I was discharged from haematology, after anticoagulant therapy for a number of months, that when I was pregnant, I would be classified as a high-risk pregnancy because my clot had been induced due to hormones. So my body would experience, you know, the hormonal changes of pregnancy. I would be at an elevated risk. So here's me, hook, line and sinker. I trust the system so much, you know, like it's so dangerous for me to be pregnant. I'm going to have to be careful, all of those kinds of things. So then fast forward in 2021, my husband and I, we had changed the date of our wedding for the third time because of COVID. So we decided, you know what, why are we waiting? Why are we putting our lives on hold? We'll have our wedding when we have our wedding. Let's just start our family. So we decided to get pregnant. We got pregnant quite quickly. We were very, very lucky. And here's me. The weekend I find out I was pregnant was the weekend of the HSE hack in Ireland. So here's me thinking, oh my God, I have this high risk pregnancy, and the HSE has been hacked and nobody's answering the phones and nobody wants to hear from me, couldn't even get into my GP. So panic, panic, panic. And 2 weeks later, after my GP had sent in a referral and I heard nothing, after I'd phoned a number of times, I'd heard nothing from the maternity unit I'd selected. And I'm very frightened at this point because I've been told, oh, you're elevated clot risk, first trimester, I didn't want to miscarry because of a clot, all of these types of things. Eventually, somebody finally returned my call and gave me the number of somebody. I need answering the phone, so nobody's really getting back to me. They're obviously dealing with more, bigger, more important things. I didn't realise that, this wasn't as high risk or as emergent as I was led to believe. But I eventually got through to someone, was seen, was assessed, had an early scan, confirmed the pregnancy was viable, and I was put on Inahep injections, so heparin injections for the duration of my pregnancy. But I kind of felt they were all very relaxed and calm around me after me receiving this message that, you're actually, very high risk. So this is where I'm an English teacher. I have a big issue with the term high risk. Like, what quantifies high risk? We're lumping everyone into this high risk category, but we're not quantifying it. All these people cannot be at the same level of risk. So there was a midwife there who told me, she said, you're probably the lowest high risk woman I've ever met. You're fine. We're hopefully we're planning for a normal delivery here. This is just an extra precaution you're taking when you're pregnant. Keep doing what you're doing because, I was active, I was fit, I was healthy while you can do it, and we'll just keep seeing you throughout the pregnancy. I was seen once by a hematologist who had the same assessment. Yeah, this clotting event was separate. We just like to take extra precautions with someone like you. You're fine. So then at the end of pregnancy, after receiving 2 COVID vaccinations and a booster, I was a close contact of someone who had contracted COVID over Christmas 2021. So being the good girl I contacted my maternity unit, even though I was asymptomatic. And I was brought in for a PCR, and my PCR was positive. But I was asymptomatic. I had all the boosters and everything in the world. I was feeling fine. But then panic buttons start being pressed again. I was about 36 weeks pregnant when I tested positive. I was being told, we'll need to induce you now at 38 weeks. I was transferred to a different unit. I had these extra scans. They're worried about COVID placentitis. They're worried about my placenta failing. All of these things. I was first time pregnant. Never even considered these things. My husband told me after the fact that he was actually more prepared than I was for our first birth. I was just trusting the system and everything I was told. He'd been doing a lot of his own reading, a lot of his own research, but he didn't want to frighten me by some of the things he was coming across. You have a lot of faith in the system. He was just absorbing everything, asking me questions, trying not to lead me in any way. But once I was outside the 14-day isolation period, I was brought in for a scheduled induction at 38 plus 4 on my first pregnancy. So induction obviously took a long time. I hyperstimulated from the pessary when I started that on day 1, so that was removed. About 2 days later then my cervix had softened enough. It wasn't really even very dilated, but enough for them to break my waters. And we're at day 3, day 4 of the induction. I was exhausted at this time, hadn't slept. I hadn't really had many contractions, but they keep waking you up to put the trace on you and different things like that. So I just hadn't managed to sleep, and it's a hospital, busy antenatal ward. You don't really sleep in those places. But I gotten to talk to lots of different staff members at this stage. A very chatty, talkative person. I'd made friends with some women on the ward who I'm still in contact with. And more than one staff member had pointed out to me, because of how long my induction was taking, that you probably need to sleep and you might get a bit more rest when you get over to delivery. It'll be quieter, and your labour is just you're very early in your first pregnancy. This is very early induction to be doing it. Maybe try breaking the waters and wait a little while before starting the drip. Have a sleep, and you may not even need the drip after a good rest. So I went into the delivery suite with this plan. That's fine, you can break my waters, but I'm waiting. I don't want to start the Syntocinon drip right now. Discussed it with other staff members, and I was just told, no, you need to start the drip. And I again pushed back. I said, no, I really want to sleep. can we, talk about it later? Then we just start with the ARM and we can get on with that after the fact. So I was told, can we start some fluids anyway? And we hang a bag of fluids and get a cannula in, because I told them it's actually quite difficult to find a vein in me. They're like, oh, we'll be fine. We'll do this every day. About 7 or 8 attempts later, when both my hands were black and blue, they finally bring in the anaesthetist to find a vein, because I told them they weren't going to be able to find a vein. So I didn't really have use of my hands at this stage because they were so bruised. So they hanged the bag, and then I said, right, I really need to go to the toilet now. So I go into the toilet. And when I was on the toilet, I genuinely thought, wow, okay, breaking the waters has really done something here, because I actually could not get off the toilet seat. I was crippled over. I felt like I was constipated, but I was like, this must be what a contraction feels like. But it took me, I think, a good 15-20 minutes to actually pull myself off the toilet, because I wasn't getting a break. I said, this doesn't seem right. I've thought contractions were meant to be waves. This was constant. Tried to wash my hands, eventually came out, and my husband said, like, when I came out that door, he said, you were like a different person. He said, I don't know what happened to you. All the colour was gone from your face. You were grey. You couldn't talk anymore. They tried to get me up on the bed to put the trace on me. I was like, oh, I can't. I need to stand. I was swaying. I was doing everything. And this was going on for about maybe an hour, hour and a half. And eventually the student midwife whispered in my ear, we think you're hyperstimulating from the Syntocinon. So the bag wasn't a bag of fluid. They'd actually started the Syntocinon. And I was
about to say,
yeah,
what you were describing being on the toilet sounds like it's like one long contraction, which I would think would be associated with the Syntocinon, but you weren't on the Syntocinon. So
but I was. Yeah. So I was upset, but I couldn't talk really at this stage. And then I started to vomit because, I wasn't getting much of a break from these contractions. The trace they had on me, I did an independent notes review after my birth, and the trace they had on me was malfunctioning. So it wasn't actually tracking my contractions at all, but it was tracking the baby's heart rate. So to track my contractions, the poor student midwife was stooped over beside me, palpating my stomach. And they weren't really listening to her. I didn't feel either, because she kept saying she is hyperstimulating. There's too much going on here. So they turned.
So Claire, I want to interrupt you just quickly. Yeah. So for anyone that's watching or listening, when you're in this situation where kind of what is hyperstimulation? So hyperstimulation can occur when we have these really prolonged contractions that are usually triggered by, artificial hormones. We have these prolonged contractions, which is, painful for mom and stressful for mom, but it also means that if uterus, it keeps just contracting for minutes and minutes and minutes, that means we're not getting any resting tone, which means we're putting mom at a much more higher risk of having a significant bleed. And the baby's not getting any oxygen.
Yeah, that's squeezing that placenta all the time.
We need that downtime between the contractions. So I'm sorry to interrupt, but just for context.
Yeah, so after that then I needed an epidural. Like I couldn't, anytime I could speak, I just kept looking at my husband like, epidural, like gas and air. I was like, I don't want to even look at it, just give me something, I need a break. Like now, you just think this year I'm on about 4 days now of sleep deprivation as well on top of this. So like I had nothing left in the tank to even start this labour. It was just, that's why I wanted to wait. I wanted a power nap at the very least. So the anaesthetist came back in, got the epidural. Oh my God, I thought I would marry her on the spot. I was delighted. And I just said to my husband, turn off the light, I need to go to sleep. But again, they don't want to turn off the lights. They're coming in with these machines. We're not in a space we're used to. We're totally unprepared for this. So I was just like, I'm going to close my eyes. I'm going to try to rest now. And at this point then, because the risk with an epidural is that your blood pressure will drop. And my blood pressure dropped. My blood pressure kind of tends to be on the low end of the spectrum, like not like anything to be concerned about. It's just I don't never have like very high blood pressure or anything like that. So that dipped, and then baby's heart rate dipped with it. So this is when the decelerations started. So it's about 6 p.m. in the evening. And from here on in, then it was no matter what position they put me in, every time they started this Syntocinon drip. Again, this was going on and off without me even being informed. And I'm on the epidural at this point, so I can talk, I'm lucid. But it's been turned off, turned on, titrated to different levels. Nobody's telling us that this is happening. And every time they turn it back on, my baby's heart rate dips, because obviously I'm hyperstimulating all this while, and the trace that they have on me isn't properly tracking my contractions, so they're not really, because they don't see it on the monitor, it's not computing, I don't think, with them. And then after a change of shift, a new SHO, senior house doctor, came on. And I have to say, along with some of the midwives I met antenatally, she was just a godsend. She just came in, just this aura of calm around her, and she just spoke to me. She was just very real about what was going on. She said, you're about a centimetre to a centimetre and a half right now. Baby's heart rate is not tolerating this right now. You are going to need Syntocinon, even if we take a break now, at some point to progress this labour. And baby and your body is not liking it at this early stage. So I would feel we are looking at a cesarean now or later. And now would be a good time to go, because you and your baby, aren't showing ring any clinical alarm bells right now. But the longer this goes on, the fact that we were getting really long decels with Teddy now at this point, I'd be worried about baby if we kept going with this. But she was lovely. She said, you need to talk about it with your partner, and I'm going to leave the room and ask me any questions you have when you come back. So Paul and I had a chat, and we said, you know what, we trust her. She's very calm, but we did feel we owned the decision. This is the only time in my whole induction I felt we were making a decision, and we're like, this is the sensible course of action at this point, because we know we've a healthy baby now. We may not have a healthy baby 6 to 9, 12 hours, however long this is going to take. So we went for the cesarean. The SHO was lovely. As I was being prepped for the surgery, I wanted skin on skin. I wanted all the things. I was planning on breastfeeding. She cut my gown to ensure that I did get it. But because we changed a shift, we had a new midwife now, and didn't really know her. I didn't have much of a connection with the other lady either in delivery. And I could just hear her. She had a big thing about me having COVID in the background. I could hear a lot of whispers about COVID, about being allowed, not allowed certain things, because we wanted to keep our placenta as well. And she's like, no, that needs to be sent to path. So the SHO got in the middle of that, and she was like, can we just take a small sample to send to pathology, just have a look at your placenta, see was there's something there that was causing these decelerations. I was fine with that, but other than that, we were taking our placenta home. That seemed to be a bit of an issue in the background. But when Teddy was born, he was perfect. We got to see him first. They lowered the drape. Big cry out of him. We got to see he was a boy first, because that was important to me that we saw the gender. And next thing, he's pulled away. And we don't get him back. I don't get my skin on skin. I wasn't given a reason why. I was just told he needed to be observed over there by the midwife. And then she announced that she was taking him. And I don't know why she was taking him, or why she just said the baby needs to be removed now from the room. So I just said to my husband, by the way, has a hearing problem. I haven't mentioned that yet. So with masks and with things like that, he was struggling to hear what was going on. So I was listening. All throughout my labour, I was trying to focus. And he just reprimanded me for this after the fact. He said, you shouldn't have been worrying about me. That's my job to worry about myself. But I was very conscious. I wanted to translate for him, because I knew he wasn't picking up on everything. So I said, they're taking the baby. And he was like, what? They're taking it? I said, yeah, she said she's taking the baby. Run after the baby. I don't know what's going on with the baby. So he goes. I'm left there on my own. And I think that was the most vulnerable time of the whole experience. They were all, now obviously the doctor's doing her job. She has to close me up quickly. So I've spoken to her since, and we DM sometimes on Instagram. I think the world of her, because she was the first person to mention VBAC to me and encourage me to pursue a VBAC. But everyone else in this room, they just start talking about me as if I'm not there. Like, I'm conscious on the table, and they're talking across me. They're talking about giving me meds. They're talking about all these different things. I started having the shakes then, which I didn't understand at the time as a reaction to the medications, and also the hormonal drop after birth. It's quite frightening. Nobody explained it to me. They just carried on, and I couldn't talk either because I was shaking so much. So it was a very, very frightening experience. And I brought into recovery, and my husband, thankfully, when he figured out the baby was fine and they were just, for some reason, taking him out of the room, he advocated for skin on skin with Teddy himself. He just ripped off his shirt and he was like, no, we want to give our baby skin on skin. So that made me feel better when I went in and I saw, okay, Paul has the baby on his chest. He's getting skin to skin from someone. That's good. All those benefits to the microbiome, he's getting all of that from Daddy at least. So Paul immediately, once I was settled, he said it straight away, we're breastfeeding, because he'd been offered a bottle a few times. And midwife then kind of rolling the eyes a little bit with the breastfeeding. I'd done a breastfeeding class. I wasn't anxious about breastfeeding. My mother breastfed 5 of us, so I'd seen enough breastfeeding in childhood. It was normal for me. So I just kind of instinctively just got the nipple in the mouth. He latched on. He was there for, I think, for the next 4 or 5 hours. So he had to be pried from me to get his baby grow on him. And we've stayed like that, me and Teddy, for pretty much the last 3 years. We've a really good, really close bond. And then when I was in hospital after the fact, I was very firm, like, oh, I have this elevated risk of a clot. I've just had surgery. I would prefer compression stockings in addition to my Ina Hep. I was told that we don't do that here. And then on my second night in hospital, I remember I buzzed a few times because I was keep logging the time that I was meant to receive my blood thinning injection. And I received it. I was very sleep deprived. I did think I received it, but it wasn't at the time I was meant to receive it, and it wasn't charted. And then the next day, my husband and I noticed swelling on my leg, and those bleeps went out. I was taken for a scan, and it was determined that there was a probable clot again in my left leg. Now, I discussed it since with my haematology team. We do feel probably not administering the blood thinning injections at the correct times or any kind of delay. That was probably the reason why. It wasn't anything I had done wrong. And, even compression stockings after surgery probably would have helped. So, yeah, we had that to deal with as well. So by the time I was leaving, I was very happy just to get out because we just felt so much safer after the fact. And I do remember another midwife saying to me, I'm just going to give you your injections and you can do them yourself. You've been doing it throughout pregnancy, so you can log the time. And that really should have been done from the get-go. Like I had full use of my hands. I was well able to administer my own blood thinning injections. I knew how to do it. So after the fact then, when I was being discharged, I had spoken to that doctor who performed the surgery. She was wonderful, and she told me I was a wonderful candidate for VBAC because I told her I didn't want to have a cesarean again, but I do want more children. And she said, wonderful candidate for VBAC. She gave me a few resources to look into, and she just said, good inter-pregnancy interval, giving your that scar lots of time to heal is the best indication for VBAC. But I'm going to chart this. She put it everywhere on my chart. I think she wrote it 7 or 8 times on my chart. Excellent candidate for VBAC, so it would be there on record. But then when I was being discharged by somebody else, they just told me, now next time you get pregnant, we don't recommend you get pregnant until you're 12 to 18 months post-cesarean. And I said, does that mean getting pregnant or delivery? Oh, it means delivering within 12 to 18 months. So again, that was kind of ringing like alarm bells in my mind. I was like, that's not what I was told. Okay. And we'll just book you in at 39 weeks for your cesarean, so you don't need to worry about anything. So I remember I was like, that's not what my chart says. That's not what I've already discussed. So as soon as I was home, big cry with my husband, and I immediately started Googling VBAC. And I found the VBAC in Ireland Facebook page. I found the Gentle Birth page. I found the app. I found loads of resources. I found other resources. I listened to every podcast going. I got an independent notes review. I became quite good friends with the midwife who did that, and she was a wonderful resource as well. And then I just became obsessed with birth. So I decided I trained to be a doula within about 9 months. I did a really, really good course with Cretia Lynch, and it was about 9 months postpartum I started that course. It was about 6 months long. And I didn't actually finish doing all the assignments for a number of months afterwards because I was just so obsessed with everything. And so by the next time I got pregnant, when we were planning our second child, because my husband and I had been on this journey together, we were very much, our eyes were wide open. We were like, home is the safest place. As we felt, we had all the information laid out in front of us. Objectively, we want a home birth. This seems to be the safest place for us, because other than this elevated risk, I'm not going to use the term high risk, the slightly elevated risk of another clot, which is higher in postpartum, and that's that first 6 weeks postpartum. We can manage that very well ourselves because we know how to use compression stockings. We know when to administer and how to administer blood thinning injections. Other than that, and this uterine scar, there aren't really, other risks we're too concerned about. So we did our research, and as soon as I was pregnant, I tried to book a private, through the private company in Ireland, the only one available here, because I didn't qualify for the HSE home birth scheme, a home birth. And 48 hours later, I was told I didn't qualify for their private home birth package because I would be using prophylactic blood thinners throughout pregnancy. So that was devastating. And I had never considered free birth at that point. I'd always thought I'd want a birth attendant with us, a registered midwife at the very least. So we did a lot of soul searching over the next few weeks. I'm not going to lie, I was in a very low place, and I was just wondering, should I have gotten pregnant at all? Should I have just been one and done? I mean, I have to think of my child here. You know, if I end up having another cesarean, if there's another clot, if it happens and I'm postpartum, I have another child at home. Like, have we made the right decision here? And I feel awful now saying that because I'm so in love with Fia, but it was a very frightening time. So then we started to consider, my husband said it to me, he said, I still think, he said, on the balance of risk, there's more of a chance of things going wrong in a hospital setting. What about free birth? And I was like, what about free birth? I don't know if I want to do a free birth. So I started looking into it tentatively and talking to people, non-judgmental people who were willing to chat to me about our options and what we could do. So I said, look, we'll plan for a free birth in the back of our minds, but we'll also plan for a hospital birth. And I said, I think this is the most sensible thing to do. We'll plan for everything. And I was planning for even, let's say we have another cesarean under general anaesthetic. We'll plan for every scenario. And as the pregnancy goes on, we'll see how we feel. We'll just keep an open mind and we'll just be as informed as we can. Because I was very informed at this stage. I knew I really, really, really wanted a vaginal delivery. But I was like, let's just be open-minded about the whole thing and see where we land. So I did all the things I'd learned from my doula training. I started seeing a chiropractor very early. I was doing acupuncture. I was doing all the lovely, nice things. And I booked in with a different hospital because, again, it's going to increase my chances of a vaginal birth. So I went for a different hospital. I decided we had funds there. We had saved for home birth. So I said, I'm going to hire a birth keeper. So someone who is a doula, but they had some additional experience around supporting a birth in the home, if that's what we wanted. So I found someone who was willing to support that, and who had witnessed enough free births that we felt confident with her as well. But equally, this is the big thing about free birth is that you are taking responsibility. You're not giving responsibility for your care over to someone else. So you're just finding someone who's a good fit, who's comfortable with the fact that you're taking responsibility and there isn't going to be another midwife there, or you're not relying on the doula to be doing things that's outside of their scope of practice. So,
and Claire, if feel free to talk about hospital names and providers and birth keepers, because some of them have been on my podcast, and I've had my own journey around free birth and gone from the midwifery idea of no, you have to have care, to really understanding why so many women feel forced, that they don't have another option, that they're not making this decision lightly, that they feel like they really are safer at home. And when you with your experience, when you speak to some of these women, it might not be the right decision for me, but I completely understand why more women are actually choosing to completely birth outside of the Irish system.
And I have to say, that's where I was coming from. Like when I was doing my doula training, I remember we were doing an assignment on home births and we had to do a reflection on free births. And I remember when I was doing that assignment that I don't judge other people's choices, but as a doula, that's not a space I would feel comfortable in, because I feel, that just as a precaution, I would like a registered medical professional there. I wouldn't want to be the one in that situation if a woman is hemorrhaging or if a baby needs to be resuscitated there there, dialing for the ambulance. That's not a space I felt comfortable in at the time. So I really did go on a journey. Tessine was our birth keeper in the end. So she's been on your podcast. And what we really liked, we did research quite a bit. And I know as a doula myself, it's about looking into different people and seeing what they're the right fit. What I really liked about Tessine was she does have a clinical background. So she is a nurse. She's a trained nurse. So I felt I could talk to her about things like the fact that I was seeing a hematologist, that I was on INAHEP, that, we would like a free birth, but we were very aware that I have a prior cesarean, I'm ticking this other box, we may need to transfer, or I might find at the end of, like if we have a very, very long labour, if we're bleeding, the fact that I've been on a blood thinner, we might have to take extra precautions and look out for other signs. So I felt very comfortable talking to her about that. She wasn't going to be looking out for those things, but my husband and I were, and she understood what we were talking about. And because I think as well, because of her clinical background and her whole philosophy, she was just she knew from talking to me that we were taking responsibility for this decision. We weren't going to be hiring a birth keeper to do things that a registered midwife would be doing, kind of behind the scenes, because I know there's a lot of controversy around free birth, and certain people who advertise their services for free birth, they probably are maybe crossing that line a little bit more into healthcare providers, when, a free birth by definition is that you're free from, for whatever reason, the medical gaze. But I would feel from the journey we've been on, and from meeting other free birthing women since and during my pregnancy, because I did make contact with other people who've been on this journey too, I would argue that, we actually are probably a lot more informed because we're taking all of this extra responsibility. We, when you're going into I can speak from experience from my first hospital birth, you're sort of raising your hands and you're going, not my job, not my responsibility, I'm trusting everyone else. It's your job to look out for everything else and keep us safe. Whereas when we were contemplating free birth, we had to, look out for signs of things like shoulder dystocia, not likely to happen in a physiological birth, but if it does, how are we going to know what's happening? And what are some things that we can do? And I realised from our research, well, over 90% of shoulder dystocias can be resolved by changing the position of the mother. So that allayed our concerns there. And then when you break down those stats, the chances of it happening, the high chance of resolving it, and then even things like, right, if we have to transfer, what position is safest for baby, even things like, we were looking into things like cord prolapse, meconium in the waters. So we were really going through every single scenario to ensure that we had a plan, because birth is unpredictable. We couldn't go in there and say, because we're not going into the hospital, it's all going to be fine. Sometimes things go wrong. But from my work as a doula and from my training as a doula and from all of my research, I did realize that if you're getting a healthy baby to term, the chances of anything happening to that baby during a physiological labour and delivery is quite small. When you're looking at the chance of stillbirth, more stillbirths will happen before labour is even initiated. It is very unlikely for it to happen during a labour without all of these medical interventions. Okay, very, very unlikely. A lot of these medical interventions to speed up the labour increase the risk of things going wrong.
And did you get? I know women that I've spoken to over the years that have made the decision to free birth are very, and I've mentioned this on some of my own groups as well, that be very intentional about who you share this information with, because we do know of women having social services turn up on their doorstep, and there being this kind of big brother is watching, and so and besides that, I would say that to anyone who's just planning a home birth with a midwife, even, because you get what if something happened is usually the go-to, and could you forgive yourself, and parents don't make this decision lightly.
No, and we were very careful about letting too many people in with that. So we did tell a few close friends, people we were close to, that we were planning a home birth because we wanted to have childcare arranged for our son. We didn't say free birth. There was a few doulas that I would be very close to, and a midwife friend who I'm not going to name, but a midwife friend. She's no longer practicing as a midwife, but she knew she kind of suspected what we were planning. We didn't really say directly, this is what we're doing. I think she suspected it. So in our chats, she'd be like, and did you know about this? And, because she was concerned. She wasn't, hired by us in any capacity or anything like that. So she wasn't responsible, but she knew that, I think just for her own peace of mind, I think she wanted to not interfere in what we were thinking of, but just to be sure that we knew everything that we needed to know, and just little gentle conversations. When I rang her after the fact and told her we had a free birth, she was like, I knew it. But it was just those kind of careful conversations. And there was a handful of doula friends I did mention it to. And again, as a doula, it's non-judgmental. That's your role. You support maternal choice. But I do have to say, we were open to all scenarios. And I remember every time, there was only 3 occasions we actually attended the hospital in the end. But each of those 3 occasions, my husband and I went together. And every time we would say to each other going in, oh, I hope they convince us to come into the hospital. I hope that this is the visit where they're going to make us feel safe and reassured, and they're going to roll out the red carpet, and we're going to feel really confident and not frightened coming in here. And I remember my first booking appointment. Oh my God. I just said, okay, I'm going to test the water. I don't agree with the BMI criteria. It's nonsensical when you look into it. I've read all of Sarah Wickham's material. We have that book. My husband and I are big into our health and fitness, so I have quite a high muscle mass. So that makes my weight look higher than it is. But if you actually physically look at me, I'm a petite person. So you'd know at a glance, this isn't a person who's overweight per se. But I do remember when I did my notes review, I had a little orange sticker on my chart that apparently, according to my BMI, I was overweight. Which was bizarre. But then, as my husband said, but you have a really low body fat ratio, so you have high muscle mass, which makes the scales look heavier. So I decided, I do have a history of anorexia from when I was a teenager, so that was, thank God I didn't see that during pregnancy, because that would have been incredibly triggering. I'm in a good place, but I know my triggers. I don't weigh myself for that reason. I just have a trusty pair of jeans that when it's feeling good, I know I'm good. When it's starting to get too tight, I know I probably just need to cut down the sugar a little bit. But I said, I'm going to test the waters and practice saying no now to the little things. So when it comes to the big day, I'm going to feel more comfortable, because I have that Irish woman complex of, I like to be a good girl and I don't like to cause a fuss, and I like people to be happy and comfortable around me. So saying no is hard for me, and saying no without apologising is very hard for me. So I'm just going to practice this now. So I said, when they offered the weight measurement and the BMI calculation, so no thank you, we've decided not to do that. Thank you very much. So somebody else was sent in to talk to me about being weighed. I said, no, thank you, we're good. Okay. The consultant will speak to you about this now in a few minutes. We do need to have your weight on file. Okay. So that, again, my husband and I are very hesitant. We went in then to the dating scan, and we told the sonographer, because I'm breastfeeding, very irregular cycles, but I know when I ovulate. We've been tracking ovulation because I've had many periods since I had my first child, because we've kept up breastfeeding. So based on my ovulation date, this is around when we think we're due. We'll decide based on the scan now, won't we? So did the scan and shaved about 6 weeks off my pregnancy straight away. Even though we both pushed back assertively, no, we know our ovulation date, so that's not physically possible. I would never ovulate that late in my cycle, or that early in my cycle. That does not make sense. And I could feel when I was pregnant as well. But no, that's the date we're going with, because you don't know when you're breastfeeding, you see. We can't rely on those other methods. And I was using multiple methods, to chart my ovulation. I know when I ovulated. So we went in, so we were a little bit thrown by all of that. We went in then to the consultant, and again, reprimanded now at this stage that I wouldn't provide a weight. And I just kind of dug my heels in at this stage, because it was annoying me. I was like, there is no reason why you need my BMI on file. You can look at me, but even if I was overweight, that does not necessarily mean it's a higher risk pregnancy. And then she asked about, well, how are you going to receive your prescription for your heparin? And I was like, I've already done that through my hematologist. I've decided, because of just for my own peace of mind, I've gone back to my hematologist in James's, and he has prescribed my heparin. He will see me later on in pregnancy. He has written to you. I have asked him to see me a little bit more during pregnancy because that's making me feel safer. He has my history and he knows everything about me. It's all in one place. I don't want anything falling through the cracks. Well, not sure if he should have done that now. We're not too happy about that. But then not in a very sensitive way, asked me, did I have a problem with my weight? Was that why I didn't want to be weighed? And again, I do have a history of anorexia. I'm not ashamed of it. But I was like, it's not really the setting where I feel comfortable divulging this. And I said, no, I just don't want to be weighed. So then I was told that it was a mandatory box on my electronic file and they could not move on to the next page unless there was something in that box. And I said, well, you can estimate it. You can put in an estimated weight by looking at me. And then I was told if I didn't provide an accurate weight, that if I required anesthetics during my delivery or other medication, they wouldn't be able to administer them because they wouldn't have an accurate weight. And I remember we didn't say this to the consultant, but I remember my husband saying when we left, we were just saying to each other, so that means if I was, in a road traffic accident and I showed up to A&E, they couldn't give me any medication unless they got the weighing scale out, even though I could be crashing and, need to be intubated and all of these things. It's like, that just does not make any sense. In an emergent situation, like, these people are trained. You can take a look at a person and go, roughly, this is the dose we need. So that didn't fly with us. So yeah, the rest of the consultation was quite tense, and I do remember the body language. I just kind of went very into myself then after that. With this battle with the BMI, I was like, oh my god, my head is already fried from this. And I never forget, she kept her hand on my thigh throughout the whole consultation, and I was at this very strange angle because she wanted to palpate my stomach, so I wasn't quite sitting upright, but because of the way her hand was on my thigh, she was sort of looming over me and I couldn't quite sit up straight. And now looking back, I was like, I probably should have told her, can you just remove your hands, that's not appropriate. But I think at the time I was just so, and again, it's the tactics that are used to kind of, you're falling off the conveyor belt now, we need to try everything we can to get you back on. It just wasn't flying. It just wasn't I just couldn't really register how to react in that situation. So I remember then she mentioned about CTG monitoring then during my labour, that I'd need continuous monitoring of my baby's heart rate. And immediately I said, oh no, we know we're not doing that already. We're going, intermittent auscultation is just as safe for VBAC, and it will reduce my chances of an unnecessary cesarean. 99% false positive rate. I've read all the work from Coerced and Small. Very, very confident we don't need to do that. All the science, she sort of talked, all the science supports the use of continuous fetal monitoring in all labours, but especially in your circumstances. You do know you're very high risk now because you've had a prior cesarean. So we kind of just let her talk at us then for the rest of the consultation. And we left. And I didn't check in at the desk to book another appointment because we had already at this stage secured antenatal care from Private Midwives Ireland. So I was like, they'll do the rest of my care in my third trimester. We have the GP, we have the haematologist. This pregnancy is going to be monitored by people. We're going to have all the information we need. So after I simmered down a few days later, I talked to a few doula friends of mine and I made the decision, do you know what, I'm going to put in a formal complaint about this because I know myself, I know what I'm about. But imagine if I did not have all this information in my head, and even I was kind of cowed a little bit in that consultation with all the information I had. This is not right that this is done to women. So I complained, I quoted the National Consent Policy, I described what I felt was coercive behaviour. My husband was a witness to it, and I mentioned that in the complaint as well, that my husband was also quite perturbed by the body language. We did mention the body language quite a bit, but just things that were said to us. And I said, I don't want this consultant over my care anymore. So you can put another consultant if it needs to be on a chart, but I don't want this person having any more dealings. And I did say in the complaint that we will attend our anatomy scan, but after that we've secured we will use our GP and we have hired a private midwife, and unless a clinical indication arises, right at this present juncture, we don't really feel we need an obstetrician. We're not currently planning a repeat cesarean. So we got a very much sort of, I'm sorry you're offended apology, not as a, that's the way you interpreted things. That's not the way it was, which is, gaslighting 101. But they did take that person off my case. They gave me someone else who I never met. I just did not attend the hospital again after that. I went for the anatomy scan because we just felt we're going to give ourselves as much information as possible. Anatomy scan was perfect. And from that point on, we just really felt that, you know, if this is how they're behaving in just the booking visit, how the hell are they going to behave when we're coming to the end of pregnancy? I just knew it in my bones, because my mother went post-term, not post-dates, post-term with most of her pregnancies, that I know I'm going to gestate late, I'm going to gestate long, and I knew we'd have a battle on our hands at the end of pregnancy. And I said, if we're dealing with this now at this early stage, how are we going to handle at the very, very end when we want to wait for a physiological labour and spontaneous labour to begin? So we decided, you know what, we're going to keep our heads clear. We are still receiving care. If anything crops up, we'll go back into the hospital. But right now, we're good. We don't need anything else. Everything we're getting, you know, we're monitoring the baby's heart rate. I'm getting my urine checked, getting my blood pressure checked. Anything crops up, we'll go in. That's what a hospital is there for, when we need them. Right now, we don't really want anything they have to offer. Don't want an epidural. Don't want prophylactic episiotomies. Hoping we don't need an instrumental birth. But the chances of needing those things automatically go up when you walk through the door. So we're trying to avoid that. So we declined then all the other offers for appointments. And then when I was around 36 weeks pregnant, my private midwife, I think she was picking up on the fact that we probably weren't going to be going to the hospital again, because I kept being told we were planning a hospital birth, and I kept correcting her. I was like, well, no, I don't have the option. The only option I'm being presented with is a hospital birth. I'm not happy about it. So I wasn't lying in those scenarios. I was trying not to talk about hospitals too much, because I was like, I knew when I would need them, but I was doing my best to just keep a good headspace for it. She contacted our hospital, and the director of midwifery there wanted us to come in, because obviously I had been the subject of maybe some discussions, because I was this bold girl who was not attending appointments. And I'd say she said she wanted us in to talk about birth preferences and to get them signed off, since I was planning a hospital birth. So we're like, and again, 36 weeks, Paul and I said to each other, we may yet need the hospital. We don't know at this stage in our pregnancy and in the labour when we might, and we were always keeping an open mind during the labour. I said, I might turn to you and say, I can't deal with it anymore, I need an epidural. We don't know what way it's going to be. I haven't had a spontaneous labour yet. You know, what if I go extremely post-dates and we're not comfortable waiting anymore? You know, we may have to go in. So again, we thought it would be a good idea just to keep those channels open for us, just to make that process a little bit more streamlined. And again, we're going in and we're saying, like, maybe they'll give us what we want now. You know, maybe we'll get access to water. Maybe we'll get intermittent auscultation. Maybe we'll get all these lovely things. Maybe we'll get them on site. So we got a lovely tour of the delivery suite. We were point out all these lovely things. Didn't like any of them. I thought there was too much machinery in the room, too many fluorescent lights, you know. No, not my scene at all. And then I was brought into the birthing suite with the birthing pool. And now you won't be using this because you have had a prior cesarean. So I'm just showing you what this room looks like. There's no need to go in because we're not going to be using that room. So I was like, okay, so very interesting. We're already getting another hard wall here that we're coming up against. So we went into our office.
I think at the moment, and I could be wrong, and I know someone will correct me, but I think at the moment only Wexford is offering the pool to VBAC women. So I might be incorrect, but I know there's women have used the pool in the Lourdes as well, and I think that person had to push very hard to get that access.
Yeah. And I could see, and you know what, I could see if we really pushed hard, and maybe if we were attending more antenatal appointments, maybe we could have gotten it. But I think we were there about 4 hours in total that day, which is very long for an antenatal visit. My God, we're going the record books now for an Irish hospital. But a lot of the discussion was, because I really didn't want anything. I didn't want VEs. I didn't want I didn't even want an admission trace or anything like that. Mm-hmm. So we were getting a lot of pushback from all of these things. We felt, and again, this was advice given to me, you know, maybe give them a little victory, maybe feel like they're getting something. So I was convinced to, you know, maybe let them do a vaginal examination on admission would be a good idea, and they might be more likely to give you your intermittent auscultation. So I remember saying to my husband, there isn't a hope in hell I'm opening my legs for anyone, but we'll just tell them we'll give them an admission VE, and if we do attend, I just won't give it to them. Like, they can't pin me down. Well, maybe they can, I don't know. But I said, I just won't give it on the day. So we'll just let them think that that's what's happening. And I did get it down on paper then, eventually, after a lot of hard-fought battle, that we'd only have intermittent auscultation. But as I said to Paul, I'm lying to them about the VE. They could easily be lying to me about the CTG. You show up on the day, there's a different doctor on call. They're not happy about this. So, we're getting all these things written down. This isn't worth the paper it's written on. Really, really and truly. It all depends on who you see on the day, which is my big bugbear with the Irish maternity system, that we don't have continuity of carer. That I really feel every woman should have one midwife. If they want appointments, like we live in Leixlip, like we've only got options of 3 Dublin hospitals. Traffic, parking is abysmal. Like we should be given the opportunity, even if you want to use your health insurance for it, to have our appointments at home, which is what we had paid for, like just the comfort of that. But you should have the same midwife that you're going to see in that delivery room and who will care for you postnatally as well, and get this early discharge home. This domino service shouldn't be reserved for these lowest of the low risk, because who's low risk anymore, And I would argue, I know Melanie Jackson in Australia, she's another midwife, she would argue that actually the women who tick a few boxes probably need that continuity of care a little bit more, because this shared care pathway, if you're everybody's responsibility, you're nobody's responsibility, and you're meeting different people all the time. And I felt that when I did my notes review when I had Teddy, things had fallen through the cracks, and there were mistakes in my chart, and there was notes about other women at different pages in my chart, so it was totally inaccurate, and even my dates had changed multiple times throughout, because obviously they were writing, because this was a paper chart system, they picked up my chart, but they were writing about someone else, because it was someone else's name was used on a few different pages. Did
you find the birth reflections helpful?
Oh God, no, it was horrific. Absolutely horrific. I wouldn't recommend it to anyone. I would recommend, if you have the funds, or if you can find the funds, I think it's worth the money to pay for someone outside of the HSE to just look through your notes for you, who has no vested interest in anything bar telling you the truth, because that was actually the most healing part of my journey with Teddy. Was that person set me down and simply said, and I know not a lot of people like this terminology, but she first thing she said to me, this was a failed induction. The procedure failed. There was nothing wrong with your body. This is a failure of a procedure. There were lots of reasons why this procedure failed, and that was very healing for me. So I was like, okay, so there is nothing fundamentally wrong with me when I'm in labour. It was all these drugs failed me, and that really helped. But yet when I went into the birth reflection service after the fact, reflecting on my first birth, I was being told, we don't really know why your body behaved like that in labour, and why your baby behaved like that, and we were misbehaving, Teddy and I. We were at fault here, and we don't know why that was happening. There was big, like when I was mentioning about the Syntocinon being applied without my consent, and I've pretty much learnt off the national consent policy since. I was like, that's illegal. That's actually assault, to be pushing a medication into somebody's vein without their knowledge or consent. If that happened in a nightclub, that's a very serious offence. Somebody slipping something in your drink and you ingesting something and you're not even aware it's there. I just don't understand how the connection isn't made between the two things. It's both assault. But I was just told, well, if I was your midwife on the day, she was just trying to help you. I would want to help you too, and just get you into labour. So I found it if I had not had that other experience of getting it done with somebody else, I think that would have really been very damaging. And I did have a lot of birth trauma afterwards, and I had a lot of problems I needed to deal with, and I think I had years of therapy afterwards, because the birth brought up other things for me. And there was a lot of things I needed to sort out in my own head before we could even think about getting pregnant again. And that's one piece of advice I give to any woman, is just to make peace with the cesarean first. If you're planning a VBAC, even if you think you have, no harm just talking to somebody about it, because all these things can come up when you're pregnant again, and you need to be sure that you know what your triggers are, and what you really feel about, and what your partner feels about it. Like Paul and I had a lot of really hard conversations, and I let him be angry at me. I allowed myself to be angry at him. We talked it all out, and it made our relationship much, much stronger. But again, he had things, resentments and anger about the whole thing that he needed to get off his chest too, before he could be a supportive birthing partner to me as well. But just going back then to our second pregnancy, we went into that appointment, and I remember leaving that appointment, and the water birth. We finally got onto the water birth. Can we have access to the pool? Because I said I really don't want to be using pharmacological drugs if I can avoid them during pregnancy at all, because I don't feel they agree with me after my last labour, number one. And number two, I said I would be very reluctant even to take a paracetamol. I would need to be pretty much suffering borderline migraine before I would even take painkillers at home, because number one, I've been breastfeeding, but number two, I'd really decluttered a lot of our cupboards, and we've really become even more health conscious since having Teddy, and I'm very reluctant to have all these things in my body unless I really and truly need them. I want to exhaust every other pain relief measure first, and then if I feel right, I need the epidural or I need the pethidine, then I will have it. But no, I wasn't going to get water. And the reasons for not having water were just so bizarre. So the first of all was because I was outside of guidelines, because I wasn't going to consent to the CTG on admission or CTG during my labour. It would make the midwives too uncomfortable to let me in the water. But I picked up on this straight away. So I was like, okay, so I'm just going to repeat this back. So because I won't consent to CTG, I can't use the water. But if I consent to CTG, because I will have the probes on my belly for the duration of labour, I also won't be able to use the water. Isn't that true? Yes, that's true. And I remember Paul and I looked at each other and we tried arguing this back, but we're like, this is a really weird cyclical argument. But she didn't seem to register that just did not make sense. So you're telling me if I consent to CTG, I could use the pool, but then I can't use the pool because I have CTG. Like, it just, and it's at the end of the day, I know some midwives don't like this phrase, but it's a bath. Like, it's a bath. I know it's hydrotherapy and it's other things and we're using it for other reasons, but at the end of the day, it is a bathtub that's in that room.
Oh, that was the same issue we had with, like, because we're seeing some of the stories online this week about different maternities.
Oh, Sligo, yeah.
Yeah, but like the Rotunda got the beautiful pool in, but they made tons of excuses why they weren't going to allow that word women into the pool, but they could go 2 doors down and get in the bath, but no in the pool. It was ridiculous. But then they pulled their pool out, taxpayers paid for that, and then they put it back in, and they're still, everyone's still weird about using the water. So they talk a good game, really.
They do, and I was speaking to a midwife actually about this yesterday, and it does come down to power. Like, when you think about it, you're in the pool, they don't have as much access to you. Like, they can't control your positions. You're not going to have continuous fetal monitoring attached to you. All they're left with is intermittent auscultation, and it's this whole thing like that. You're there's more work involved as well, because you need to be in the room more if you're going to be doing CTG. You're not going to have as much time for your charting or for other things, and at the end of the day, if you are a stretched maternity hospital, if you're an overworked midwife and you can't even guarantee you're going to get 5 minutes to go to the toilet during a 12-hour shift, it's much easier if you have your women with epidurals on the bed, CTG monitor, and that's tracking everything, and it's easier. You can get all your charting done, you can get it all done, and it's the system is so broken, it's forcing the women into a very unsafe scenario to help the system continue to function, rather than all of us just looking at it. And my husband and I really, like the rose-tinted glasses are off, we're like, can we just have a look at what's going wrong with the system first? Like, why are they doing all this charting? And my husband's a records manager, and we talked about this often enough. Like, we've all of these admin people in the HSE. Like, can we not have these midwives using dictaphones, or we have the technology now, and somebody else is there transcribing these notes for them, just listening to the dictaphone, so they can actually focus on what they should be doing, which is giving these women the high quality care that they need. And I'm sure a lot of midwives go into this job wanting to do that.
And
the job is something else.
And it's you learn on the first day of placement that this was not what I signed up for. Yeah. I signed up to care for women, to give women support and nurturing and yes, the clinical care, but the clinical care takes priority and anything else then comes. That's why I would say anyone watching, listening, I don't care how many babies you've had, if you're going into an Irish hospital, bring a doula.
Oh God, and that's why I
First
became a
baby, 10th
doula.
baby, bring a
Yeah,
doula. You need
yeah.
someone watching and advocating for you. I know there's debate about whether doulas advocate for you, but what we're seeing at the moment within many different systems around the world, doulas have to take a little bit more of an active role,
Yeah.
as do the birth partners and as do moms, because the induction rates that we're seeing in Ireland now are just, we're
Oh
not going to see any spontaneous labours in the next couple of years, and women have to
no,
start
no,
educating themselves and saying no.
and it's extraordinary as well. We're the only country in the world right now that written into our national induction policy is 41 weeks. That's not even term. Like we actually were the only, and I know it's happening all over the
And we're
world
not even
since the arrival
waiting until
but
41 weeks. That's the problem.
no,
It's routine, especially if you're a first time mom, that it'll
yeah.
be like 39 weeks. Come on, sure.
Yeah, yeah, and the sweep starting possibly even from 37, 38 weeks. So,
Yeah.
and that is an inductive too. Like, why else are you doing
Yeah.
a sweep? And
We're
I know
just
that can be controversial.
normalizing a routine induction now for absolutely
Yeah.
no medical reason at all. And so many
Yeah.
women are coming out of the system now traumatized,
Oh,
physically,
completely.
mentally, emotionally, and spiritually.
Yeah, but it's normalized. Like that's the thing I found after my birth with Teddy. Like I was just, what has happened? My husband felt the same thing. We both cried as soon as he got in the door. Like what has just happened to us? But then the messaging I was receiving from a lot of people I was surprised at was, but you have a healthy baby. And I hate that phrase now. I will never say that to anyone. But you have a healthy baby. Just get on with it. You just have to get on with it. And that's what we all do. That can't be normal. I mean, how would we have evolved to this point as a species if that's how we actually
Yeah.
birthed?
But
It does
because,
not make
because
sense.
we have normalized this now, it's so when you meet somebody, in Tesco's with their new baby, it's like, how'd you get on? Oh, I had nose induced and I had this, but sure, it's grand, because isn't that how everyone experiences it now? And that's become the norm, and we cannot normalize that amount of intervention on healthy
Yeah.
women and babies.
But it's rare, like when you look at the stats, you're looking at in some units, like 1 to 2% of physiological births is all that's happening, which is, it's so dangerous for people, really.
Yeah.
But like that, my husband and I, we left that appointment and we looked at each other. We're like, this is not a safe place to be. So we had looked at all of the stats. We knew we picked the hospital that was probably the safer of the three in Dublin by our barometer of safety when we were looking at intervention rates. But from that interaction, we knew that, we were doing our best to advocate now, but there would be a battle in labour. And as a doula, I understand the hormonal cocktail. And as I said to us, even if you're doing it for me, even if, Tessine, if we decide to transfer in, if the two of you are doing it for me, and again, that was why I wanted someone with a clinical background, because I knew she would understand the lingo, she'd be able to pick up on things if we were in hospital, going on behind the scenes, so she would be able to say, no, really, you are getting deep D cells now, or they're saying they're D cells, like that the baby's heart rate's fine. It's in this barometer, so I really felt I needed someone like that there. But I said, I won't be able to tune that out. I will not be able to tune that out. And I said, how can I release oxytocin if we're dealing with this? Like, it's just not going to happen. And I said, and equally, I don't want to wait until I'm 10 centimeters dilated and transferring in the car. Like, that's not going to be working for me either. So, we continued with antenatal care. So the midwife we had at that point, I think she had another number of other things going on. I've no harbour, no resentment or anything there, but I do feel she suspected at the end of that meeting that we probably weren't going to attend the hospital. So she did all she could to convince us to attend more hospital appointments. When it became very clear that I wouldn't, she decided she didn't want to continue care for us. She felt she was working outside her scope of practice, which I respect. I prefer her saying that then rather than, getting to 40, 41 weeks and then suddenly we've nothing. So we advocated strongly with the company, and they provided us with another midwife who continued with our antenatal care. We secured our postnatal care. We'd also purchased a postnatal care package. The only thing they weren't willing to sell us was the delivery package. So we're like, look, we know we have a postnatal midwife that we can call immediately after delivery, so we could get all the checks after on me and baby. We don't need to attend a hospital. We know we're receiving antenatal care. We still had the GP. I got additional blood work done with the GP. So we're getting all these tests and screenings. The only thing we weren't getting was additional ultrasounds, but there was no indication for an ultrasound or anything at this point. So we felt like we have a lot of information here. There is nothing here that's happening in my body that I am not aware of. And I wasn't feeling untoward or unwell. Like my hemoglobin was a little bit low, my platelets were a little bit low, but they were within the range of normal for pregnancy. Right. So I just taking my Floradex, taking my active iron. I had been signed off work, so I was just resting, enjoying time with my toddler before the newborn arrived. So I was just, and again, good food. I was doing acupuncture. I was drinking my bone broth. I was, doing all the things. Just not. I wasn't trying to induce labor, but I was just doing all the things I knew of that could prime my body. So I was doing the dates, I was doing the raspberry leaf tea, and I was very clear even with my acupuncturist, I do not want to induce this labor. I want to wait until baby is ready, but I want my body to be as primed as it can be for when labor transpires. I also consulted with some homeopaths. So we had different essential oils in the house. We had different herbs that we knew. My biggest fear was not uterine rupture. It was actually postpartum hemorrhage because I had been on INAHEP and because of the very big case we had in Ireland last summer of a woman who had an unattended birth and who hemorrhaged after the fact and quite sadly passed away. So that news came out when we were talking about Freebirth. So we had to really dig deep there and go, right, what are the signs of a hemorrhage? What can cause a hemorrhage? And I think that was our big thing. What can cause a hemorrhage? Trying to actively manage the birth of the placenta can induce a hemorrhage. Prophylactically reacting, to a hemorrhage is not, that is one of the ways we can treat it, but stepping in and trying to rush that placenta out could induce a hemorrhage. So we're like, but it's a HSE policy to have active management of the placenta. And again, I had it documented. I did not want that. But, when you're after having a baby, that was my big fear as well, was that someone's going to start yanking on that cord and shove Syntocinon or Syntocinon into my thigh without my knowledge. And that's going to be happening. So that was my big, big fear. And I said that could induce, sometimes that can even induce uterine rupture postpartum. So I was very concerned about that. So we looked at the different signs, of hemorrhage. And, as I said to Paul, I was like, look, I'm quite confident that if I am bleeding, there is a lot we can do and transferring. And I think it'd be the chances of me bleeding, when you look at what increases the risks of a hemorrhage, it's much lower when we're in the home and when we're not doing other things, and when a bag of Syntocinon is not hanging there, and when I can adopt my own positions for delivery, etc. But also, and this is good to discuss with Tessine, she said as well, you've been on INHEP, your blood is thinner, so your blood is going to be more viscousy. So, we have to bear that in mind as well. It could look like a hemorrhage at a glance, but there could be a lot of clotting behind that. You could actually be okay. So we have to look at the other clinical indications like your BP, your demeanour, your pallor, other things. Yeah. And there's a lot we can do to deal with that before we start, ringing alarm bells. So I think that toward the end of pregnancy, that's what Paul and I were really just trying to discuss with each other. It was that in the hospital you have to navigate other people's fears that they're projecting onto you. We did not share the same fears that the system shared. So we just didn't feel it was the appropriate place for us toward the end. And then as we came toward the end of pregnancy, as per my dates, I got to 40 weeks, got to 41 weeks, got to 42 weeks. We're like, okay, so it's happening. I knew I was going to go post-term. And then I started getting nervous. I was like, right, I'm at 42 weeks. I felt confident things were happening. Like I could feel baby drop. Baby was descending. We had that last antenatal appointment we had with our midwife was actually slap bang 41 plus 6. And we discussed then. She was wonderful. She brought out all the information, and she really detailed information on her charts about all the different risks of going post-term. And we discussed them all, what puts you at higher risk for a stillbirth. And we found that we weren't actually ticking many of those boxes at all. We were receiving antenatal care. The one thing she would recommend was to have an additional scan just to assess the placental function, just to be sure that everything was going well, to check fluid levels, all of those kind of things. So we discussed all of that, and we still felt very confident to continue on with the pregnancy after that. This was a 2-hour conversation we had, and she had printed off lots of resources for us as well that she talked us through. And again, I was aware of a lot of this information. I'd used a lot of these sources before, but it really helped to discuss it with a professional. And she documented in the chart that we are making informed decisions to continue with the pregnancy, and that at that day as well, I'd been starting to get little niggles. So I felt something was happening, and I did ask because I did not want sweeps, but I trusted this person. I was like, because this was going to be our last appointment, we weren't going to continue care beyond this point. And I said, when I'm going into the hospital, if at this point, if I go into the hospital, I know it's because I'm going to need or want them to get this labour going, or possibly just give me another cesarean at this stage. So I said, before we do that, I said, I would like a sweep from someone I trust and someone I know. So we had another 40-minute conversation about what is involved in a sweep. You never get this in an Irish hospital, by the way, but the risks of a sweep, what a sweep could possibly do. So we talked about all the figures and everything. At the end of that conversation, she said, do you still want a sweep? And at any point during this, we don't need to continue. And it just made me feel so safe, because even we did the vaginal exam, she told me what she felt in the vaginal exam, that, I asked her, could she give me a Bishop score, just out of my own curiosity. And I said, like, by hospital definitions, your Bishop score is quite low. We're not going to be able to do much here. She gave me a sweep. But I had been having like little niggles, little cramps, little backaches, so I felt comfortable having a sweep at that point, because I was like, this might be enough to push me over the edge. And a bit of my mucus plug actually came away when she did that, so I was like, okay, this is good. But she said, look, it may not start anything, the chances of it doing anything are still very low, but at least I felt, in my peace of mind, I was like, I've tried everything I possibly can at home. The only thing I hadn't done was castor oil, and I was saving the castor oil. I was like, if I need to go into the hospital, that castor oil is what I'll do the day before. So that would be my last port call. And again, I discussed castor oil with her, because again, I'm a VBAC, so she said I wouldn't do a full dose of castor oil. This is what I would take, and she gave me her criteria for using castor oil in the home. For a VBAC client. So we chatted about all of that. It was very sad to see her go, but that was the end of our relationship then, because we had a different midwife for our postnatal care. So after that then, I had 3 more days to go before labour actually started, and every evening after that, so this was a Monday evening, so Tuesday, Wednesday evening, it was around the same time every evening, around 4 p.m, around the time my son would wake up from his nap, I would start to get these niggles. I'd do my bouncing on the ball, I was chewing on my pineapple, zipping my tea, nibbling on my dates, and I was like, maybe it's tonight, and I was just like, okay, I'm not timing them, I'm not going to do anything like this, kind of just go into my head. And I remember I'd go to sleep each night, and I'd say to Paul, I could be waking you up now in the early hours of the morning, it could be happening, and I'd wake up and it would all have gone away. So there was 2 nights of this, and I do remember on the Wednesday night I got up, because I was quite upset at this stage, because I really felt, I think I'm going to have to swallow my pride it's not swallowing my pride, but I really feel I'm just going to have to, we're getting to the end of the line here. I'm going to have to go into the hospital very soon. I knew that, because we're over 42 weeks, and I was like, if this labour does not start, that's it. And I had a good cry for myself. So maybe I should have just booked the elective cesarean at 39 weeks, and I wouldn't have had to deal with any of this. I would have just had a really easy time with it during my pregnancy. But I actually think I needed to get all of that out. And I remember my husband got up. He said, I saw you on your own, and he said, you just needed time to yourself. So he said, I left you. I went to bed. I was just checking that you weren't in labour. And when I knew you weren't in labour, I left you alone. So I put on the lights in the Christmas tree, because they made me feel happy. Bounced on the ball for a little while. Went back up to bed. Slept for a while, and that Thursday was actually the first day my son we didn't have our childminder. She was taking her Christmas holidays, so we had our son all to ourselves. We had a lovely day. We went in, we did some grocery shopping, got him a little haircut, and I remember looking back at him in the back seat and thinking like, oh, his hair's so short now. I was like, my baby's really gone. And I remember rubbing my belly and thinking, good thing I have another baby on the way, because my big baby's getting really big and it's making me sad. And we got home, and I remember nursing him to sleep, and I just could not. I normally would have a little nap with him, and he'd have a nap, and I just could not get comfortable. My back was aching. It was like, and now in hindsight, I was in early labour, but I was just like, oh, I really need a nap. I didn't sleep well last night. I just really want to sleep, so I gave up trying to have a nap. I rang my husband. He was just upstairs. I was just too lazy to get up. I was like, could you just start doing the dinner? I'm not in any mood to start dinner. Would you just do it? So I came down by 4 p.m, started the dinner. My son woke up, and I just did my normal evening routine. I was like, look, I'm getting these cramps again. It's nothing. It's just all going to go away again. Just going to bounce on this ball. Not going to think anything of it. I was just bouncing on the ball, and I started to feel nauseous. And then this big contraction overcame me. And I was like, yeah, I can't sit upright anymore. So I just got onto all fours on the ball. I didn't say anything. My husband just popped in, and he's told me since, he was like, I knew you were in labour, but he said, I didn't want to say anything. I was too afraid to say anything. Did not want to tempt fate. So he just went out to the kitchen, came back a few minutes later, and he's like, "Do you need anything?" And I was like, "Just get me the clary sage." Get me the clary sage, because I said, if this is starting, I said, it might push me over the edge. I was, I'm not waiting another day. So got the clary sage, just put on a little tissue, inhaled it, and that was enough. Like, I was in labour after that. So my little boy, God love him, like, I just wanted to play the birthing videos around him so he'd be used to the sounds. So I started making the low guttural moaning sounds. And Teddy just came up to me and started rubbing my shoulder. He's like, "Mommy, it's okay. This is how baby comes out. This is how baby comes." He just knew. And I kept saying to him between contractions, "Don't be scared, don't be scared." So, "I'm not scared, Mommy. I'm not." He started playing with his cars. He was absolutely fine in the same room. And I vomited a few times, and again, he wasn't scared, he wasn't perturbed by anything. He just kept telling Daddy, "This is how baby comes out. It's okay, this is how baby comes out." So we rang a friend. She just lives a few doors up for us, and Paul was like, we're go at last. So she came over. She got a little bag for Teddy, collected Teddy. Again, didn't say anything. This is a woman who's had 2 natural labours, so she knows what it's like. She just popped her head in. She all looking good, Paul, you're good. Took Teddy away with her. She's 2 small children as well, so she took him for the evening. And then, like, Paul he got the TENS machine for me, started to inflate the pool, just quietly getting everything ready in the background. Text Tessine to say, yeah, we're finally at Go Stations. We'll be in touch soon. And then about 9-10 p.m. he decided, just himself, he's like, I'm going to bring Teddy home, and then if we need Trina during the night, we'll ring her again. But he brought him home, put him up to bed, which was good, actually. I needed some space to myself. Like, he wasn't getting, I felt like I just wanted to be alone at that point. So he came back downstairs to me then. Unbeknownst to myself, I actually wasn't turning off the TENS machine at all, even between contractions at this stage. I was like, no, I like it too much. I'm just going to keep it on full whack. But it was making me very comfortable. And then Paul decided, he said, I'm just going to fill the pool, so it's there when you want it. You're not asking me, I'm just going to do it. I've had the water on, I'm just going to keep doing this. And then around 11 p.m. he contacted Tessine again, and he was like, yeah, I think you should come now, because he was timing them. He said they are getting closer together, and she doesn't realise it, but she's maxed out the TENS machine. She's going to need to get in the pool soon. So things seem to be happening. So Tessine came in, and when Tessine came through the door, I just said to her, I feel like I'm pushing. And she's like, yeah, great, push away if you want to push, do what your body's telling you to do. So I was getting these urges to push. So I was saying, oh great, yeah, I'm coming to the end of it, I feel really good. And I remember between contractions making eye contact with Paul. I was like, I know I was vomiting and I was doing all these things. I was like, this is nothing like the Syntocinon ones. I was like, it's intense, but like I work out quite a bit. It felt like doing a heavy lift, like you're holding for that 10 seconds and it just goes away and you've time to build up to it. So it didn't feel intolerable to me. I was like, I don't feel like I need the epidural at all. This is great. Got in the pool, and again, water was just a godsend. It was just, that was all I needed. So this went on then for a number of hours. And I didn't realise, and then I was feeling really good. I was like, oh, I think this baby's coming now any minute. And then I'd say, wasn't keeping track at the time, but just with the power of hindsight now, I'd say it was about 4 or 5 a.m. in the morning. I was like, oh, I'm done. I'm so tired. Like, I just want to sleep. Can this baby just come out? And bear in mind, like, I've had no vaginal examination, so I don't know where I am. I don't know how far I am, but I know things are happening. I'm saying these things, but I know baby's coming down, and I know she's doing what she needs to do. I had all I could really ingest, because I was vomiting so much, was just I had frozen ice cubes of different electrolyte drinks. So I was just taking them in for energy. And I remember Tessine just suggesting, she's like, maybe get out of the pool and we'll go, because she noticed I hadn't gone to the bathroom in a while. So I went to the bathroom and I voided my bowels. So again, great sign. I knew when I did that, I was like, okay, yeah, baby's coming. I knew all of these things. So got back in the pool. And again, having all this knowledge as a doula was really reassuring, even though I was kind of in labour land, but I was aware of all these things. I remember looking down and I saw that my knees were coming in and my ankles were going out just instinctively. And I was like, oh, the pelvic outlet's opening. Okay, this is good. And it's so funny, because I said these things aloud and I just must have sounded so funny, but I was like kind of like analysing my own labours. It's amazing to see this in action. I wasn't even aware I was doing this. So then all the while I was getting these little urges to push, but then it was really ramping up and the contractions were really coming on top of each other. And then I thought I was pushing earlier, but then that fetal ejection reflex started, and I could feel a bulge when I put my hands down there. I was like, no, the head, I can feel something's happening now. And just instinctively I had to stand up. So with each contraction I was standing up. Poor Paul was in this really kind of a weird crouch position because I was using his shoulders to brace myself, and I was pushing, and then between contractions I go down into the washer again and just pour the washer over myself, and Tessine would just pour it over my back just for comfort. And then eventually I did feel that burning. I did feel the burning, and I was like, oh God, don't tear. I knew all the things to don't tear. I was just panting. I was like, slowly with the head. And then I just felt the head pop. And at that point the washers broke. Now, because I was post 42 weeks, I knew it was very likely we were going to get meconium in the washers. And I knew, which is one of the reasons why I didn't want A or M or anything this time around, because there would likely be something in the washers. And I knew the different types of meconium to be concerned about, fresh meconium versus old meconium. And Tessine was behind me, and she goes, yeah, we have mech. And I just remember saying, that's okay. I knew there would be mech, we'd be fine. I wasn't too panicked, and my washers hadn't broken until that point. And I do remember I was standing above the washer at this stage, and I could feel her head. I put down, felt her head, and again, just all the knowledge I had, I was like, now Tessine, I can't go back in the water because the baby's head is out. And I'd say she must have been rolling her eyes laughing at me. And I was like, and I don't know if I can catch her at this angle. Can you lean forward? Can you catch her? So next contraction, she literally just popped out. Tessine just helped me catch her. And I pulled her up to my chest, and I just collapsed into the water, like the biggest feeling of relief when she was finally in my arms. And then I just remember looking at her. She was the spitting image of Teddy. She just has a little bit more hair. And I just remember I didn't cry, but just feeling sad that I didn't get that moment with Teddy. And I remember just I never had this with Teddy, and just holding her to my chest. I did suck. I just put my own mouth over her nose and mouth and just sucked out the mech myself. There was just a little bit around her face, but she hadn't inhaled it, and she was still attached to the cord. And then she let out this beautiful cry, was breathing herself. Nothing wrong with her at all. I just kept stimulating her very gently, trying to keep her in the water because we were still in the pool at this stage. So I don't know how long we were there. I do remember I heard Teddy shouting upstairs, give me my baby, because he heard the baby crying. So I said, Paul, you better run up and get him. So Paul ran up and he grabbed Teddy and he brought him downstairs. And I think he was a bit surprised because of all of the blood and all the different things. He was like, "Ooh, no, I don't want to look at that." Can I put on Paw Patrol? Was one of the first things he said. We're like, no, Mama doesn't want to watch Paw Patrol right now. We'll just wait. We'll wait for a little while. And then I just felt an ache in my back. So I was like, ooh, okay, maybe the placenta's getting ready to go. So I just handed Fia over to Paul, and Tessine helped to get me out of the pool. And literally I just put one leg up and placenta fell out. I didn't feel a contraction, didn't feel anything with the rest of the sac. So it was fully intact because we could see the amniotic sac was still there. So knew I didn't have anything retained at that stage. So just took a bit of a breather on the couch. I nursed Fia for a little bit, and then Tessine, again, this is why I wanted someone like this around, like a proper wise woman. She was like, right, we need to go to the toilet now. We need to make sure the bladder is working and all those things. So she helped me go to the toilet to clean myself up. I hadn't actually had a lot of fluid throughout labour because I was vomiting so much. So I knew I wasn't going to be able to pee. I was just very, and I was emptying my bladder quite a bit. So we just hydrated a little bit, and we did notice I was bleeding. But I felt good. And we did notice as well, I had torn, and I have a lot of varicose veins from my previous clot around my pelvis, but around my labia and things like that. So I knew, like a flesh wound, it would bleed a lot. So I could see I was bleeding, but I was like, it's not coming from inside me, this is from the wound. So we weren't too concerned. Like, it looked like it was a lot, and if I was in hospital, I'm sure there would have been ringing alarm bells, but I could see that this is coming from a tear. This is nothing really to be too overly concerned about. So we went upstairs, weighed Fia, checked all of those things, and then a little while later Paul just contacted our postnatal midwife. She came along about maybe 6 hours after the birth. She popped in, we showed her the placenta, she assessed me, she did agree there was a tear. I was so euphoric that I had done what I had done. I was like, oh, it's only a grade 2, let it heal itself, it'll be fine. Now in hindsight, I probably should have gotten in and just gotten the repair done. She was like, oh, I don't know, I think that might need a couple of stitches, but I was like, no, be fine, I'll just lie here and it'll all just heal itself. But I was feeling really, really good, and Fia was wonderful. And then about 2 days later, she was checking on me every day. We're like, that this isn't healing right. We are going to have to go in. So again, if anyone is like in a similar position to me and they're feeling throughout labour, they're being pushed towards a free birth, I do feel it was sensible to keep some channels open with the hospital, because then when I did need to attend to get my repair done, it was relatively seamless. So, you know, we had the letter of referral from our midwife, we attended. I know how hospitals work, so I waited until the fresh shift were starting first thing on the morning, went in when there was nobody in the A&E waiting room in the maternity hospital. We got seen to very, very quickly. I know there was a bit of shock that, wait, you delivered on Friday, it's Monday, why did you wait so long? We normally repair these. There was a bit of back and forth about that. I knew they probably thought I was probably for the birds. But yeah, we did need to go into theatre just to get the washout because we had delayed the repair for that long. Had to take some antibiotics, which I was very, like, there was a nice conversation we had with them. Yeah. Everything felt very informed, and it was sensible to take antibiotics at that point. They were reopening a wound, restitching it. Yeah. That's the sensible thing to do. There was a little bit of navigating about keeping Fia. They initially wanted to put me in a gynae ward, and I was like, I'm breastfeeding. Like, if you want to do a repair, the baby's coming with me. So we got a room and postnatal I do feel, even from both my experiences, there can be an element of a little bit of punitive treatment when you step outside the guidelines, or when, you know, I do feel that was, I know, and maybe I'm just being very cynical, but I felt, I remember saying to Paul, I was like, I think that was a little bit punitive what they were trying to do.
No,
a little bit of a power play.
I think you're correct in that feeling of was there some aspects that were punitive, because we do see it time and time again on the VBAC in Ireland group, where women feel like, because I wanted evidence-based care because I was asking for something that wasn't being offered, which evidence-based care should be the standard, that they felt, they were treated differently. Yeah. And there was a different attitude from some of the staff, which is really just unacceptable. That these midwives and consultants and doctors are looking after very vulnerable women, and to punish them for asking for very, very reasonable requests, asking for intermittent monitoring, or asking for the evidence for the we could talk about the CTGs in Ireland.
Oh God,
but I just wanted to mention that, because I think there is quite a bit of fear around, you know, well, if I ask for this, you know, are they going to harm me and my baby, or is my care going to be different? And I'd love to be able to say, you know, absolutely not. Your care providers are professionals, and they will do their utmost to support you and to provide healthy, safe care. But as we've seen on the group, women's experiences are not reflecting that at all. Yeah. In many circumstances, yeah.
But I do feel, though, in saying that, like when I wrote my birth preferences and when I did put in the complaint early in my pregnancy, I did cite that I'm very familiar with the National Consent Policy. Like, I'm a post-primary teacher by training. I did a level 9 course last year around active consent and some training with rape crisis. So I'm very familiar with Irish law, how rape is defined in Irish law, which is actually the dictionary definition of vaginal examination, you know, coercing people into having penetration of their vagina. That is actually a criminal offence if you aren't consenting to that openly, and if you are not aware that you don't have to do that even. So I was very aware of all these things, and I knew I'd footnoted my birth preferences with different studies and different things. So it was very, very clear. I was very, very informed. So I do feel, and I know there can be an element of punitive treatment, but I do feel if you be the difficult person, I think be a bit of a headache, and show, you don't have to argue your case. I don't believe you should get into a debate too much with consultants and things like that, but document it. Like, I just did it all via a written complaint, and I made it very clear I've read the National Consent Policy. I don't think a lot of these professionals, I think there's more of a focus on hospital policies rather than a consent policy. And I do think if that was given the same amount of attention as some other less evidence-based policies, I think people would be far, just the way of talking to people would be very different. Because I do feel then when I got into theatre, there was that little, and again, was that punitive, wasn't it? But when I got into theatre after the fact, I do think when they had my chart in front of them and they saw my birth preferences, and I had been very clear that I had a traumatic birth first time around, and going into theatre was not easy for me. I anticipated, but when I went in there, oh God, my chest constricted. I'd done a lot of work, you know, antenatally and between my pregnancies, but being in that space again, it just brought all of the memories back of that cesarean. And I was, you know, very nervous, but they were wonderful in theatre. That's the one thing I will say. I remember there was 2 theatre nurses just held my hands, and one just hugged me and rocked me just before they placed, because I was getting a spinal block for the procedure, because again that was very triggering for me, and she could see how I was hyperventilating, so she was just, you know, she just hugged me, and I think it was just to regulate my breathing, but she didn't really say very much. She was just lovely. I just felt like it was just like this lovely warm hug was just really, really calmed me down. And throughout the procedure, the consultant actually performs the procedure. She was wonderful. She kept up and up informing me, because she knew I wanted to be informed. It's like, right, I've just assessed we do not have a 3rd degree tear. Now we're going to open the wound and we're going to see what's there. Yeah, there is some necrotic tissue, so we're going to wash away that necrotic tissue. But she talked me through the entire procedure. Right. Now, I know some women may not like that. I liked it. That grounded me and made me feel very calm. And it did make me feel like nothing was being done to me. You know, that there wasn't, like, I was part of what was happening and I understood what was happening.
And this is what individualized care is supposed to be. But
this should be the standard.
Yeah.
This should be the standard for everyone. You know, you shouldn't have to fight. Shouldn't have had to document or fight as hard as we did for that. That should be, but that's trauma informed care also. Like by default, if we gave everyone trauma informed care, we would not have the rates of birth trauma that we do, because you're just treating people as human beings. Yeah. At the end of the day. But yeah, we were very happy by how it all went. I don't feel we would have had a vaginal delivery if we had attended the hospital, especially with my dates the way they were. The fact that I was on INAHEP, I found out after the fact when I was being prepped for theatre that apparently I had thrombocytopenia. I don't have thrombocytopenia, never had a history of thrombocytopenia, but that was on my chart and they kept quoting it when they're doing the handover, and I kept perking up. It's like, no, I don't. I only had my booking bloods done with this hospital. I have other blood work I can show you. But I know what my platelet count needs to be to meet the diagnostic criteria for thrombocytopenia. It's not that. Because I know at one point they tried to tell me I was anemic as well. And I was like, yeah, I had lowish hemoglobin throughout pregnancy. I had very low hemoglobin when they checked my bloods there. But again, you are going to have that postnatally, and I managed to get it up very, very quickly just with my active iron and my Floradex and
Claire, what stands out to me here is, and it's, you know, as Ireland continues down this road of over medicalization of so many women's birth at the moment, especially first timers, it's just the you know, medical mistakes and documentation errors that happened, just for your experience. Yeah. Because we are now overwhelming the staff, because we have so much, you know, medicalized care now, we're just going to see those mistakes increase.
Yeah.
Because the midwives are so stretched, and it's because we are back to this medicalization of birth. So midwives are tasked with additional medical care that they wouldn't have to do if they were supporting more physiological birth. So we're going to, so I think for anyone watching or listening, you have to, for the safest care maternity services in Ireland, you have to be able to self-advocate. You have to know what's in your chart, and it does feel overwhelming to try and get this information. Yeah. And I've always said, you know, women should not need to become mini midwives or mini obstetricians during their pregnancy. They shouldn't have to go and read the national consent guidelines because their consultant is trying to, you know, coerce them into, you know, the induction or repeat cesarean. And I do intentionally use the word coerce because I know people are going to be jumping up and down because I'm saying this. It is happening in Ireland, and it's happening regularly. And it's not, and it's consultants, and it is some midwives and other care providers, but it's
But
it's
the thing
unacceptable.
is, it's not individuals. Anyone who's listening to this and thinking like, oh, we're all being painted with this bad negative image now, and that we're all anti-hospital, anti-midwife. I've met some wonderful obstetricians and doctors. I've met some wonderful midwives. It's the system. It's almost cult-like. It's this indoctrination that happens, that people are more afraid of stepping outside the guidelines and policies. I was speaking with a midwife yesterday about different jurisdictions and how they do things. Like if you were in the UK, you would simply document that this person is developing a plan that's outside of guidelines. Just document it. Just document it, that this is clearly a person who's making an informed decision, and at the end of the day, that is their inherent right to make an autonomous decision. Whereas in Ireland, because the system is so overwhelmed, because it's so short-staffed, because it's so hyper-medicalised, it is too hard to do that. It's too difficult to do that. It's easier to try and get people back onto the conveyor belt. Get on the conveyor belt, get them through, get that live baby out of them. Wash our hands, not our problem anymore. But because everything's so hyper-medicalised, you've spoken with Safer Births Ireland before, you can see the stats. Mistakes are being made. And we are seeing, we don't have extraordinarily high, birth injuries or stillbirth rates, but we still have a lot of cases going through the courts, where mistakes are happening because the system is so overwhelmed. And it's this high risk categorization. There is no proper analysis of what does that word high mean. I'm an English teacher, and what does high mean by definition? Like even telling me you're high risk for a uterine rupture, it's less than 1%. By any definition, that's not high. And having a repeat cesarean, you're doing a planned rupture of the uterus. You're still rupturing the uterus. You're not eliminating uterine rupture. You're just planning for it in theatre. That doesn't necessarily make everything safer. It's a systemic issue. It's not the people who are at fault. It's just this whole system has been. It's ready to implode. I mean, we're seeing it now in the HSE.
And we're seeing more my colleagues that I would have trained with and colleagues that have been in midwifery for many, many years, they're just running out of steam.
Yeah.
The midwives
burnt out,
are running out of steam, and it won't be, because at the moment we do have a cohort of midwives around the country that really are focused on normal birth, on physiological birth, on informed birth and informed decision making, and all the parts of maternity service that can make our maternity services safer and more empowering for mothers. But they are now at a point where it's like, we're tired. We're fighting so long, we're tired, and we're getting to that point where they're like, there's nothing more I can do. And because I've been at it for so long, and there's no sense of, we had this maternity strategy, national maternity strategy, that just died on the vine with the...
Where are the birth centres?
Yeah.
Well, I'd love to know where those birth centres went.
The thing, turkeys don't vote for Christmas. Consultants are never going to allow those birth centres to happen under HSE.
They didn't even allow the phrase midwifery-led care in it. They came up with all this other quangle terminology. What does that mean?
Yeah.
Yeah.
But Claire, what advice would you give to someone who is kind of, thinking about what their options are, who may have had, a similar experience within maternity services themselves? Maybe they've had a previous cesarean, or maybe they just have had a traumatic birth. What would you say to someone who is considering going outside of the system? Or, what would you say to someone who's listening to that?
Well, again, I don't ascribe to the philosophy. I know there are some people who ascribe to Freebirth as in, nothing can ever go wrong if, there's no medical intervention. I did come to Freebirth rather reluctantly. Like, it was the best of the options we felt that were being presented to us. We felt it was the option that presented the least amount of risk and harm for us personally. But I would say is understand what happened to you the first time. So having an independent notes review. I know, we're in a cost of living crisis. A lot of people don't have a lot of money, and you kind of feel, the public system, it's free, but, how much are you willing to spend on your wedding? And like how like you will save for things that matter. You will cut back on other things. Like Paul and I, when we were trying to be pregnant, we saved for this pregnancy because we knew we wanted to try and get that home birth, so we'd save for that. We knew we wanted to do that. So those upfront costs, they may be eye-watering initially, but I do actually think they will save you so much trauma and heartache on the other side of it all. But I definitely think get your hospital notes, pay for someone who's independent of the HSE to explain them to you, to put the timeline in order, because I do think they're deliberately constructed to be hard to read. And even, I know you said you don't need to become a mini midwife, but I do think we probably do need to be more medically literate. And in Ireland, we've a very odd culture. Like, I have friends and have contacts in other jurisdictions who find it so bizarre that you go in and you get blood work done and you don't get the results sent to you. I find, and it's rather patronising. Like, they're like, oh, you couldn't understand it if it was there in front of you. Like, I went and got extra blood work done by my GP and insisted that I had the lab report, and I understood the values, and it's not hard you can do a quick Google search to find ranges that your hemoglobin should sit, and it's actually on the chart anyway. It's a little line in red if you are outside of the range of normal, and then you can research that further or get someone to talk you through, get your GP to talk you through it, get your midwife, bring it in with you to an antenatal appointment, say, I have my lab report, can you talk me through this? You don't have to become necessarily a mini midwife, but just those little things. Don't accept that, we'll call you if something comes up in your blood work. No, that's my blood work, I want it. Get into the habit of advocating. Get into the habit of practicing saying no as well, because I found that very hard. That was very hard for me to do that. And it showed me what I was dealing with as well. So, don't save it all for the end of the pregnancy and when you do go into labour, when you're planning your birth. It's very important that, you practice advocating in just little spaces throughout the pregnancy, because toward the end of the pregnancy, the way your brain changes, the hormonal cocktail changes, you are in a more vulnerable place. You are going to default more to fawning rather than and you don't want to fight either, you don't want to be aggressive, just to practice those gentle assertive skills. And unfortunately, I do think people need to read things like the national consent policy. I do think we had a brilliant survey that was published recently from UL, the Birth Alliance team, and it was read that report. It's freely available. Read, if you are booking in with a unit, go through their stats, the patient statement reports. They're hard to access. They're very hard to access. They're not up to date.
They are buried so far into the HSE website, and when I looked at them recently, it's like they're months out of date. And it's
it's crazy.
It's just voluntarily that they just, like, nobody's held to account.
No,
anything in Irish maternity service, nobody's held to account.
And even like for VBAC, they don't report VBACs, which I find, and we all know why, because the rates are so low. But you should have all this information going in, and you should be able to go in, adopt that American mentality, that you are hiring through your taxes, you are paying for this service. It's not free, and even if you're going through the public system, people kind of have a sense of like, you kind of get what you're given. No, I was going through the public system. I advocate. I said, I don't want that consultant anywhere near me again. If you're not happy, if you don't feel that you're gelling well with the person, you don't have to pay privately for that. You are well within your rights to say, we are not going to work well together. This person and I have different philosophies, and I want someone who has a bit more experience. And when I looked into this consultant, I realised that their speciality is gynae and cervical cancer. So I'm sure if I ever need them, that's who I want to go to. But I want an expert in vaginal birth after cesarean for my case, please, or someone who is an advocate for physiological birth. There's a lot of responsibility we have to take on, and I just think the way the system is designed, and you hear it time and time again, it takes a lot of responsibility away from women and parents. You know, we are responsible for so much, and that's not sustainable. That's not sustainable for midwives. It's not sustainable for obstetricians, and immorally, it's very dubious as well, because the individuals and the families have to live with the consequences of decisions that are made around their pregnancy, around their birth, around their delivery, and it's morally, I don't feel it's right to take that away from them. I think this idea of shared decision making, it has to become a reality where you provide all of the information, as you should do as per the national consent policy, and trust that when someone makes an informed decision, that that's the decision that's right for them. That may not necessarily be the decision that you would make. So for example, I've a close friend who's had 3 cesareans back to back. I don't judge her. I don't question her decisions. I would not do it. That's not for me. She would not do what I have done, most certainly not. But we don't judge each other, you know, and we have to take this judgment out. Just because you wouldn't make the same decision as someone else doesn't necessarily mean it's wrong.
Yeah. And just on the idea of shared decision making is becoming kind of more of a buzzword, but I'm still, I'm like, yes, shared discussion around the decision making, but ultimately that decision is the mother's, and the fact that, again, women have to fight for, like, you go to the UK and it would be documented that this decision has been made. You're not going to have 10 people trotting into your room to try and convince you otherwise, which is what happens in Ireland. Well, we're going to send the consultant in now to talk to you. We're going to send
but even for a simple weight check, at booking, this was happening, this escalation of care.
You can imagine a decision that is
like,
a little bit more like a decision around CTG, how that would be received. So Claire.
So that's why I would say test the waters during your pregnancy, and know your own sense of safety. Like, you know, work it out. What are you most afraid of? And work that out, because everyone is different.
Final words.
I would say I would just don't judge others, and don't feel like you have to take on other people's opinions either. You know, take on all the information and come to your own decisions. That's what I would say. Just find that information out, advocate for yourself, and just make your own decisions. I don't like the idea of people giving advice or recommendations, you know. Just come at things in your own way. Like I went I went extremely post-term because I looked up all the information. I made a decision that was right for me, and I didn't let anyone else into that. I didn't discuss it with anyone. So I think we just have to become more comfortable just making our own decisions. And I don't think, like, I'm an educator, I see it myself. I don't think we engineer or prepare people into adulthood to do that very well as a society.
So. Claire, thank you, and please thank Paul for looking after the kids today while we had a chat. But I really appreciate you just sharing your journey, your experience, and because I think it'll be really helpful for other women in Ireland just to hear about what is the reality of birth in Ireland, and how can you start to work towards having the most empowered and the safest birth possible for you.
And safety is relative. Safety is relative. It's what's safe for you. You know, that's Well, thank you, Tracy.
Right. Yeah, thanks so much, Claire. Will because I know there may be people interested in contacting you and talking to you about your work as a doula or your experiences. So if you're happy, I'll include some contact details in the show notes, and if people want to reach out to you there. Well, thank you for your time. It was lovely to finally meet you, and maybe we'll have Paul come on another day and talk about it from the dad's experience, because I think that would be great to hear as well.
Oh, I think he would be very willing, because he had a big journey as well. Yeah. And I think he has a lot of empathy for the dads out there. You know, they need as much support, I think, sometimes as well.
Oh, absolutely. And because for a lot of the dads, they never get a chance to debrief what happened the first time. And sometimes they're bringing additional fear to it. So the fact that you had mentioned that it was Paul that mentioned Freebirth before you did is fascinating. So I'd love to have a chat with him if he'd be up for it. But
definitely
enjoy the rest of your day, and thanks again. We will talk again soon.
Yeah, you too, Tracy.
All right, thanks, Claire. Take care. Bye.
Thank you so much for tuning into today's episode. Remember, empowerment begins with knowledge. If you enjoyed our time together and want more content like this, don't forget to like, subscribe, and share with your friends. So stay inspired, stay informed, and until next time, take care of yourself.